Broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to CFN's webinar series. The topic of today's session will be supporting quality of life assessments of frail older adults and their family caregivers. Our presenters today are Dr. Richard Sawatsky from Trinity Western University and Dr. Kara Shik-Makarov from the University of Alberta. My name is Jeanette Prorock, and I'll be hosting the webinar today. As always, please feel free to share any questions you might have for our presenters in the chat box, and following the presentation, we will answer as many questions as time permits. And once again, as usual, following the webinar, a survey will pop up on your screen. Please be sure to fill it out and provide us with valuable feedback on how we can improve this webinar series. The webinar slides and video from today will be available for viewing online within 1 to 2 days at cfn-nce.ca under our webinars tab there. In terms of next upcoming webinars, we're currently in the scheduling process, so we don't have any specific dates to report right now. But if you take a look at our website under webinars, you'll be provided with the latest dates of any new webinars that will be scheduled. So with that, a little bit about our presenters. So Dr. Richard Sawatsky is Professor and Canada Research Chair in Person-Centered Outcomes at Trinity Western University. He is also the head of Patient-Reported Outcomes Programs at the Centre for Health Evaluation and Outcome Sciences. And Dr. Kara Shik-Makarov is Assistant Professor at the Faculty of Nursing at the University of Alberta. She also completed her postdoctoral fellowship at the University of Alberta. So with that, I'll turn it over to our presenters to share their presentation with us.
Great. Thank you very much for that introduction. So my name is Richard Sawatsky, and very pleased to have this opportunity to share our work on supporting quality of life assessments with frail older adults and their family caregivers. So we've structured our presentation along a couple of learning objectives that correspond with our program of research on quality of life assessments, with a particular emphasis on older adults who are living at home with frailty and their family caregivers. So the first objective is to understand the use of quality of life assessment tools for this population. I'm going to give you some background on what quality of life assessment entails so that we have a common understanding of what this is about. The second objective is, as our focus is on knowledge translation, we intend to share results about knowledge gaps, barriers, and the need for knowledge translation resources to support the use of quality of life assessment tools. And finally, throughout the webinar, we will be describing the process and results of co-developing tailored knowledge translation resources on quality of life assessments to address those gaps, barriers, and needs for knowledge translation. So I'll begin with providing some background on quality of life assessments. As mentioned, our focus today is on older adults who are living at home with frailty. And these people often have complex health challenges that affect their ability to function, as well as their quality of life. In addition, their family caregivers' quality of life can be affected, as they often assume major responsibility for coordinating and delivering care. Routine assessments of their quality of life, both patients and family caregivers, is therefore necessary to ensure that their priorities and concerns are visible to healthcare providers, leaders, and decision makers. Such quality of life assessments involve asking older adults and their family caregivers about what matters to them, about their health and their healthcare experiences. And we've structured this along the lines of 3 key questions. The first is questions about how are you doing? The second is questions about how is your care? And the third addresses what matters to you. The answers to these questions provide foundational information or building blocks for person-centered care. As shown in the quote to the left, patients and families' quality of life, as well as their experiences with healthcare, should be routinely and comprehensively acknowledged and assessed as an important imperative of person-centered care. This involves ensuring that care is guided by information about the experiences of patients and family caregivers, as well as their outcomes. For example, patient-centered performance indicators such as wait times are often used to get information about care experience. And similarly, clinical outcomes are relied upon to monitor the impact and effectiveness of our healthcare services. However, the information from the perspectives of patients and family caregivers is not as readily available or visible in our health information systems. And this is where quality of life assessments can make a difference. Such assessments involve obtaining information about how people are doing from their point of view in terms of various aspects of their health and healthcare experiences, all of which are important to their quality of life. Examples include information about symptoms, physical functioning, psychological and social well-being, as well as information about relationships with healthcare providers, involvement in decision-making, and being treated with respect and dignity. There are many tools available to facilitate the process of collecting and using quality of life assessment information to address these questions. Patient-reported outcome measures, or PROMs, provide information about how patients are doing by asking people to respond to questions about their symptoms, their physical functioning, as well as their psychological, social, and even existential well-being. And patient-reported experience measures, or PREMs, are standardized questionnaire type of tools that provide information about people's perceptions of the care they receive. These tools typically include questions about patients and family caregivers' perspectives of their relationships with healthcare providers, involvement in decision-making, and being treated with respect and dignity. Here is an example of a PROM, or Quality of Life Assessment tool, called the McGill Quality of Life Questionnaire Expanded. It is being used in many of our studies and consists of 21 questions about aspects of health and quality of life that are known to be important for people who are living with life-limiting conditions, including frailty. This is just shown as an example, and there's many, many more patient-reported outcome instruments available. Many of them are indexed in the Quality of Life Assessment Information Database. ProQual ID is freely available online. You could find information of over 1,000 tools there. So this is just meant as an example, but in general, the Quality of Life Assessment tools ask about these type of domains. There's also tools specifically developed for family caregivers. And the example shown here is the Quality of Life Threatening Illness Family Caregiver version, which is increasingly used for family caregivers of older adults who are living with frailty or life-threatening illness. And there's also patient-reported experience measures for people with life-threatening illness. And examples here is the Can Help instrument, developed by Darren Hayland and colleagues. Can Help stands for the Canadian Healthcare Evaluation Projects Questionnaire. And it includes questions about relationships with care providers, illness management, communication, involvement in decision-making, and also a question about feeling at peace. An example question is, you were treated by doctors, nurses, and other members of the healthcare team in a manner that preserved your sense of dignity. So how are these quality of life assessment tools integrated into our healthcare services? In this figure, we show how at the individual level, collection of quality of life assessment information can be facilitated by including quality of life assessment tools in personal health record systems where patients and family caregivers have opportunity to respond to assessment questions on a regular basis and share this information with their healthcare providers. This information is then used as part of a shared decision-making process to ultimately enhance person-centered care by involving the patient, family caregiver, and healthcare providers to jointly determine goals of care and treatments. You can find more information about this in our previous CFN webinar on the quality of life and practice support system, where we provide an example of this type of system and how it was developed. In addition, once systematically collected, quality of life assessment information can also be used at population or aggregate levels by, for example, healthcare managers and leaders to inform quality improvement, public accountability, and person-centered health policies. An important consideration, therefore, is that quality of life assessment information is used by different people for different purposes at various levels of healthcare decision-making, as is shown in this slide. At the micro level, quality of life assessment information is used by healthcare recipients and providers to inform shared decision-making and person-centered care. At the meso level, which refers to organizational level of decision-making, quality of life assessment data can inform quality improvement initiative. And at the macro level, involves use of this data for public accountability and to inform healthy public policies and public health policies at various levels of government, provincially, nationally, and internationally. And as explained in our manuscript on macro, meso, macro practice tensions in using patient-reported outcomes and experience measures, these different purposes and uses of quality of life assessment data could lead to confusion and even tension across different users. It is therefore important that the different users of this information have good understanding of how quality of life information can be used to inform healthcare decision-making and person-centered care at each of these different levels of the healthcare systems. Patients and family caregivers need to understand what quality of life assessments are and how the information can be used to improve their care and healthcare of others. Healthcare professionals need to understand how quality of life assessment data can be integrated with clinical health data and evidence-based knowledge to inform clinical decisions in person-centered care. And healthcare managers and leaders need to know how to interpret aggregate results for program evaluation and quality improvement purposes. And even government leaders need to understand the value of monitoring population health and health system performance from the perspectives of patients and family caregivers. In summary, our research targets the use of quality of life assessment tools in clinical practice and for healthcare services decision-making, with a particular emphasis on older adults who are living at home with frailty and their family caregivers. It builds on decades of research involving many clinical trials and systematic reviews that indicates quality of life assessments can help to empower patients and family caregivers, can guide meaningful conversations, can help to improve shared decision-making, and ultimately can promote person and family-centered care. And our research also addresses the use of quality of life assessment tools that are increasingly used at meso and macro levels of healthcare decision-making. However, despite this evidence base, the routine use of quality of life assessment tools with older adults who are living at home and their family caregivers has been quite limited. In our previous research and reviews, we have found that this is partly due to a lack of supportive resources on how to use quality of life assessment information. The project we are presenting today is therefore designed to address this need by focusing on the development of knowledge translation resources to facilitate the routine use of quality of life assessments. So I'll now hand it over to Kara, who will continue to provide some information about the design of our project.
Thanks, Rick. So next slide, if you don't mind. Thanks. So to address the needs that Rick just identified for knowledge translation resources, or KT resources, we undertook this project to support quality of life assessments for frail older adults and their family caregivers. And of course, we just want to acknowledge and thank support from CFN. And I just want to highlight on this slide our website, www.healthyqol.com. And here is where you'll find the resources that we're going to discuss in their development. Next slide, please. So the question we wanted to answer was, what knowledge translation resources do micro, meso, and macro knowledge users need to support the use of quality of life assessment instruments with older adults living with frailty at home and their family caregivers? So our objective here was to co-develop tailored knowledge translation resources for 4 different knowledge user groups. So the first group was frail older adults and family caregivers. The second group was healthcare professionals. Third was healthcare managers and leaders. And fourth was government leaders and decision makers. And next slide, please. So to answer this question, we recognized we really needed a diverse team. And we had 4 panels helping us, and the members are listed here, including HQPs. And this is our innovation community. It encompassed a researcher panel, frail older adults and family caregiver panel, which is in the center and at the core of our work, healthcare provider, manager, and leader panel, and also government leader and decision maker panel. And they were involved throughout the project, beginning with proposal writing. Next slide, please. So our project involved mixed methods research, drawing on principles of implementation science and integrated knowledge translation to inform development, implementation, and preliminary evaluation of KT resources for each of the knowledge user groups. So first, we needed to identify knowledge gaps and needs for each of these 4 knowledge user groups. So we held interviews and focus groups accordingly and analyzed this qualitative data to help us understand the gaps and barriers that the KT resources could address. And second, in partnership, we outlined the content and the type of KT resource specific to each knowledge user group. And our innovation community provided iterative rounds of feedback, and we then came to the limits of our collective expertise and contracted both a content editor and graphic designer. Third, we took completed drafts of the KT resources into interviews with participants from each knowledge user group for formative evaluation. And then based on their feedback, we refined the resource. And this is that first green arrow going now from right to left. And then fourth, we posted the resources on www.healthyqol.com, and we undertook preliminary summative evaluation through an online survey. And we recognize that future work will certainly entail further refinement and testing, and this is denoted by the second green arrow going from right to left in an iterative fashion. And next slide, please. We are most grateful to the research participants who volunteered their time and shared with us their expertise. So these included 11 frail older adults and family caregivers in the first round of interviews and focus groups, and then an additional 9 in the second round of formative interviews. And this is what that vertical line means on the slide between the numbers. We also had 13 healthcare professionals in the first round and 4 in the formative interviews, 14 plus 6 healthcare managers and leaders, and 9 plus 4 government leaders and decision makers. So in total, we had 70 knowledge users, plus our panel members who informed the co-development of these tools. And we're now going to share with you our results. I'm going to pass it back to Rick.
Great, thanks, Kara. So I'll share the results on patients and family caregivers. And what we're going to do is very briefly share some highlights from our initial interviews and focus groups. And then we're going to give some examples of the resources that we developed. So here's a brief summary of results from our interviews with frail older adult patients and family caregivers. So you can see they articulated the need for very practical information, focusing on understanding what quality of life assessments are, who use quality of life assessments, how quality of life assessments are done, what the purpose is, and ultimately how this will improve their care. They also expressed some reservations or concerns about questionnaires being potentially burdensome, as well as concerns about not being able to respond to questions due to cognitive impairments or sensory challenges. They also drew attention to some possible technology barriers, such as not knowing how to use technology or being scared of technology in situations where the quality of life assessments are done through online systems, for example. In our interviews, we also asked for their perspectives on the types of recommended resources that we could develop to help address these needs. And so when probing further, we learned that the patients and family caregivers preferred short and to-the-point resources. They did not want a lot of text, such as brief videos and short written materials. They also expressed a need for very practical forms of support in completing the questionnaires and training opportunities, such as active engagement in one-on-one sessions or training and filling out the assessments, or possibly even doing the assessment forms together with clinicians. The following quote captures the overall sentiment of patients and family caregivers. I think the key is going to be culture change. I feel optimistic about timing right now because there's a really big push on standardizing areas of care that can be standardized and also integrating the patient's perspective. Need to think of ride that wave somehow of making sure it gets integrated. So we took all that information and then worked with our knowledge user panels to figure out, well, which of these knowledge gaps and barriers could we actually address through the development on online resources. And our project was really focused specifically only on online resources. You may have seen from the previous slide that there are some other areas of support that would need to be met in different ways. So in this case, we developed several online resources that are freely available on our website, healthyqol.com. The first is a brief brochure entitled Living Your Best Life Possible, which provides short, to-the-point information about what quality of life assessments are, the role of patients and family caregivers in providing and using this information, and how healthcare providers use this information to improve their care. So it's an initial introduction, and you could go online and click on it. And some of the graphics from that brochure have already been used in our previous slides. We also developed a frequently asked questions pamphlet that addresses the most pertinent questions that arose from our analysis of the interviews, so targeting specific knowledge gaps. And we concluded with very to-the-point guidance on what to do in terms of answering the questions online each time before you have an appointment with your healthcare provider, asking your health provider if you can talk about the answers you provided when you're at your appointment, and learning more about viewing these videos and brochures. So one of the things we developed is a series of 2 videos. The first video is a is more like a film. It's a 6-minute film that provides more of a lived experiential account of how quality of life assessments could be used in the daily lives of a frail older adult patient and his family caregiver. And the second video is an animation video. It's only 2 minutes that provides an initial introduction to quality of life assessments. And so I'm going to show right now the 2 minutes animation video. And if we have time at the end of our seminar, we'll also take opportunity to show the 6-minute film. We'll have to see where we end up, but I'll show this animation video first. Great. So that's an example of one of the resources we developed. The film or the animation film was developed by Madison Muhig Stenner, who is a student at Trinity Western University in film studies, and with support, of course, of the other HQPs and the entire team going through this iterative process of developing content and modifying content based on the formative evaluation. So we'll now go on to the other users, and I'll pass it on to Karen.
Terrific. Thank you. So from the healthcare providers, we learned of their knowledge gaps and needs related to understanding how to use and integrate quality of life assessments in clinical practice. And their perceived barriers included things like workload and lack of time, some technology barriers that they referred to, particularly integration with multiple platforms. And they were concerned that patients and families would think that quality of life assessments took too long or only provided a brief snapshot. And it's important to note that the frail older adults and family caregivers did not fully support this concern, but nonetheless, they had that, the healthcare providers had that concern. This group recommended that resources could potentially sustain their interest, again, be concise, provide examples, and pragmatically support their use of quality of life assessments in practice, regardless of the mode. And next slide, please. So in response, we created a conversation starter brochure with talking points for healthcare providers. And we also created a mythbuster, including insights on common misconceptions associated with quality of life assessments for frail older adults and family caregivers. And some of the takeaways for this knowledge user group is incorporate the use of quality of life assessments in your practice. Engage both older adults living with frailty and their family caregivers in quality of life assessments, and use the quality of life assessment responses to inform care decisions. And next slide, please. This is just an excerpt from one of the resources. One of the common myths is that quality of life assessments take away from the relational side of healthcare. And a response informed by the evidence is that quality of life assessments promote relational care by uncovering unmet needs and providing an opportunity to facilitate a therapeutic relationship. So this is one of the resources you'll see online. And next slide, please. Just moving to the next knowledge user group, healthcare managers and leaders. From them, we learned of their knowledge gaps and needs related to understanding how PROM and PREM information can be used in their practice, including QI or quality improvement. And they too felt constrained by a lack of time, lack of training in quality of life assessment, juggling multiple electronic platforms. And they recommended that resources show them how quality of life assessments could be used, particularly in organizational decision-making at a meso level. And detailed examples are outlined on this slide in front of you. Next slide, please. So in response to their expertise and feedback, we created a conversation starter brochure with talking points for healthcare managers and leaders to use in their discussions, particularly with other healthcare leaders and decision makers. And we also created a fact sheet with detailed explanation of how quality of life assessment data is used at individual and aggregated levels of healthcare at a meso level specifically. So some takeaways for this group: start the conversation with other healthcare managers and leaders. Access reports on quality of life assessment data, and then use this quality of life assessment reports to inform healthcare decisions. Next slide, please. For our last knowledge user group, from government leaders and decision makers, we learned of their knowledge gaps and needs related to understanding how to access, use, and interpret PROM and PREM information in decision making. So their perceived barriers included use of different tools across organizations, costs and resources, sometimes time lags between data collection and reporting for decision-making purposes. And their recommendations were that knowledge translation resources offer examples of use in decision-making, how to support interpretation of the data. They recommended the resources be concise, but also that they could come alive through the use of stories, and that they be tailored specifically to their scope of practice. So you'll see on the next slide that we created a fact sheet and also a frequently asked questions brochure about quality of life assessments. And you'll see an excerpt here on the slide addressing one of the quality of life assessments, use of quality of life assessments to monitor performance, improve quality, inform policy, and budget decisions. So these resources were ultimately designed and tailored to highlight the value of using quality of life assessment data by government leaders and decision makers in system-wide healthcare decisions. Next slide, please. So one of the thorny questions of all research is, so what? So we offer 3 insights. So first, different knowledge user groups have different knowledge gaps. So KT resources must be tailored accordingly. The second is that different knowledge user groups have different needs pertaining to quality of life assessments, and they use different language due to their context and their scope and their work and their life. So development of KT resources may support their unique needs. And last, across the groups, the knowledge users thought that online resources such as evidence-based information, infographics, videos would support their use of quality of life assessment tools. So I'm just going to pass it back to Rick as we wrap up.
Great, thank you, Kara. So we'll conclude with a brief showing of this film, and then we have one more slide in conclusion. So this film was developed by Madison Stenner, who was a Summer Student Award recipient and also a HQP on the project, and again was developed with input from information from this project, and all of the other HQPs provided input as well. And she works with live actors and to develop this video for the purposes of conveying the quality of life assessment from a more experiential point of view. So just give me a moment to get this started. Here we go. Great. So that was one of the videos that we developed, and we would very much welcome your feedback on it. And if you think it's helpful, to help us also distribute it and share it with other people. I'll just conclude here with a thank you for joining our webinar, and we would very much like to, we have time remaining and would very much welcome a discussion on the remaining time. There's so much more that we could say, of course, about the formative evaluation and also the summative evaluation, but we left out a lot of details for the sake of time and for the sake of focusing on the resources that we developed. But please visit our website at healthyqol.com, where you could access all the resources. And I'll also say that at the bottom of the resources, I'll just try to give you a quick example here. At the bottom of the web page, you can see information about additional resources, including a document containing all the references, with references for each statement that is made in each of the quality of life assessment resources. So we have supporting evidence for each of the statements and claims that we are making. And we've also conducted an environmental scan, which will be posted probably within the next couple of days even. It's pretty much it's just being formatted right now, and so you may be interested in that as well. So thanks again for joining, and I'll turn it back to CFN for moderating the discussion. Thank you.
Great. Thank you both so much for that presentation and very interesting resources that were developed. One of the questions that's come in is actually related to the resources and whether they are available in other languages beyond English.
That's a great question. They're not currently available in other languages. That wasn't within scope of our project. I should say that we actually just last week had a discussion with the director of the Center of Person-Centered Care at the University of Gothenburg. So they have an internationally recognized Center on Person-Centered Care led by Dr. Joachim Oljen. And they are interested in translating this in Sweden. They're all, of course, available under Creative Commons, so a license. So if anybody else wants to translate them, we'd be very much welcoming a discussion about that and wanting to see them translated.
Great. Another question that's come in here says, hi to you both. Great presentation and excellent research work. I am a research associate in a time-sensitive cardiac surgery setting, interested in supporting the use of quality of life assessment tools in standard practice. This individual is asking, how can individual researchers deal with the barrier identified by care providers that there are a whole host of disparate resources, tools, and measurements they need to be cognizant of? Why should my particular set of quality of life assessment tools take priority, especially in a time-sensitive acute care setting?
Yeah, great question. And Kara, feel free to jump in. We are conducting a series of studies on integrating quality of life assessment in various different populations. One of our studies focuses on integration into the home care environment, where similar questions arise. And our general process is to work with each of the care providers and the family caregivers and patients to actually jointly determine which quality of life assessment tools are going to be most useful and informative in that particular context. We think that starting there is a very important. So avoiding kind of a top-down approach of like, here, use this tool, from, well, let's look at all the tools that are available and come up with a joint decision. And that might seem like a laborious process, but it can actually be quite efficient. There's good databases and information on tools available to help inform that decision. But Kara is looking more in other disease contexts. You want to say a bit about that, Kara?
Yeah, sure. Within our programs of research, as Rick mentioned, another context is specifically in dialysis and kidney care. And you're bang on the money in the sense that there are often competing priorities, and so when you bring together different people from different perspectives, one of the points of collaboration is how do we choose? And as Rick said, it's bringing people together to engage in that decision so that it's not made in silos to the best of your capacity. There certainly are resources widely available, particularly through ISAQUAL, the International Society of Quality of Life, that does provide resources and references that can provide guidance to teams making these decisions. I guess what I would just say is a really pragmatic first step that I would probably ask in a clinical environment is, are we actually talking about quality of life assessment tools? Because sometimes for practitioners, they think, let me back up. By that, I mean, is the person living with the illness or the family caregiver, are they providing self-assessment on their own without proxy? And if they're not, perhaps we're talking about clinician assessment. And kind of starting there is a really important first step, and then going forward into the next decisions. But of course, you're very welcome to contact us directly to have further conversation about. Wonderful question.
Yeah.
Great, thank you for those responses. The next question that's come in is, what educational levels were the patients and their caregivers? Also, what was the cognitive level required to be included in the study?
Yeah, also very good question. So we have a slide, I'll just bring up I don't know if people are still seeing my screen or not. Are they?
No, not right now.
No. Okay, so we showed a previous slide that gives a little bit of information about educational level. We have a lot more background, of course, on these people, but the patients and family caregivers in our initial sample included 5 people, of which 1 had a high school only as highest education, 4 college, people with college degrees, and then there were an additional 6 people with undergraduate and postgraduate degrees. So fairly well-educated people on average, I should say, and that may have influenced the results. It's very possible. But I should say that these people were also involved in our other quality of life assessment projects. So these were not people that were completely unfamiliar with quality of life assessments. And we thought it was important, at least at this initial stage, to start with a group of people that have at least some sense of what we're talking about, rather than starting from a completely uninformed audience. But our next step is of course, we've done a preliminary formative summative evaluation. We want to continue that to hopefully get feedback and input from a more diverse group of people.
Great.
This is Kara. I'm just going to jump in on the second part of that question, if you don't mind, about cognitive impairment.
Oh, I forgot.
Yep, no problem. For particularly for frail older adults. So because this was a formal research project, it meant that they had to provide informed consent. And so that meant that as we explained the project, we wanted to ensure that they were tracking what they were consenting to, being able to provide responses and engage in ongoing conversation. And of course, with informed consent, it's an ongoing form of consent. So we did not, if people had cognitive impairments that were mild or moderate, they were certainly welcome to engage and participate. We didn't formally screen cognitive impairment. I want to be clear about that. We did screen about frailty. We used a frailty measure. So we did not exclude people based on cognitive impairment, but we also needed to ensure that they were able to provide informed consent throughout the process of the research.
Great, thank you. A quick question, are the outcome measures available on the Healthy QOL website?
We haven't made the measures available. Do you mean the quality of life assessment tools? I just need to clarify.
The question states, are the outcome measures available? So they didn't unfortunately clarify, but
yeah. I think this probably refers to the quality of life assessment tools.
Sorry to interrupt. They've come in saying yes, that they did mean the tools by that.
Yeah, exactly. So there are actually, if you go into our environmental scan, which is about to be posted, there are links there to other websites. There are quite large indices available online. I recommend the PROQOLID database that is made available by MAPI. They index over 1,000 different tools, including generic patient-reported outcome measures and disease-specific ones, as well as some patient-reported experience measures. And they provide a database of all kinds of information about these tools. They have a free access point, which provides some very basic information, but one can also purchase a license in which you can get a lot more information in it, including the actual copies of the tools. So we didn't seek to replicate that as it's available elsewhere. I should say that we've also completed just finished a review of quality of life assessment tools for frail older adults and family caregivers across transitions in care. And so we've actually done a psychometric comparison of all of these tools, as well as other sources of evidence, and as well as CARE has done a meta-narrative review that's now published. And so that will become available soon as well. And as soon as those publications are available, we'll make those available on this website as well.
Great, thank you. I think we've got time for one more quick one. Could you clarify which frailty tool you used for screening?
Prisma. Easy question.
Prisma 7.
And
yeah,
maybe,
the Prisma 7.
Okay. And
so it had to be a tool that could be self-administered, because that's how we were connecting with patients and family caregivers. So that was our limitation.
Okay.
In addition, it was a tool used in that by our Fraser Health partner that's already being used, so it was familiar to them.
So we've still got a couple more. We have 2 more minutes, so maybe I will squeeze in one more. Was there any difference in engagement of fee-for-service versus salaried doctors?
Oh, Kara, do you have a thought about that?
So 2 things. Number one, we did not take the data to compare and contrast. So to be honest, I would say I don't know.
No.
Yeah.
That's a very interesting question.
Very.
But we hadn't thought of that.
Okay. So just being cognizant of the time, we're coming up to the end of the hour. Dr. Sawatsky and Dr. Shik-Makarov, did you have any final comments you wanted to make before we wrap up?
This is Kara. I just wanted to thank you for the opportunity, and thank you to the people that attended online and sent in the questions. You just added to the richness of this opportunity, and so thank you.
Mm-hmm. And I'll just add my thanks, and please share the resources. They're freely available on that website, and we want to see them be used. And if you have any feedback, please contact us, because this is not the end. So we very much want to continue developing them.
So again, on behalf of CFN, thank you to you both for your excellent presentation today. The contact information for Dr. Sawatsky and Dr. Shik-Makarov is on the screen there. So I know there's still a couple of questions that had come in that perhaps we didn't have the time to answer, so we can pass those along, or feel free to reach out to them with any questions regarding today's presentation. And once again, a reminder that a survey will pop up on your screen after this webinar, and please do provide us with feedback on how we can improve these webinar series. Other than that, stay tuned to our website, and I will be in touch once we've got further webinars scheduled for this year. Thank you so much, everyone.
Thank you.